According to a 2018 article by Australasian Medical Journal, an estimated 2.5 million deaths are prevented annually by vaccines. In 2009, the New England Journal of Medicine stated that vaccines are the most effective prevention tool available. When vaccines were first introduced during the turn of the 19th century, smallpox was running rampant. Shortly after the creation of the vaccine in 1809, it became mandatory in most states as well as most countries. The United Kingdom even fined people that did not comply and gave out the vaccine free of charge. Lindsay Bever for the Washington Post found that before the MMR, or measles, mumps, and rubella vaccine, an estimated 3 to 4 million patients were infected each year, with around 48,000 hospitalized, 400 to 500 dying, and 10,000 suffering from encephalitis, a complication involving the swelling of the brain. This is in the U.S. alone. Since their introduction, vaccines have saved millions of lives. However, a recent decline in vaccinations and a rising anti-vax sentiment show the clear need for mandatory vaccines. Vaccines work as a whole because of the herd immunity, defined by the CDC as a situation in which a sufficient proportion of the population is immune to an infectious disease through vaccination to make its spread from person to person unlikely. Even individuals not vaccinated, such as newborns and those with chronic illnesses, are offered protection because the disease has little opportunity to spread within the community, also known as community immunity. An article entitled "Does Compulsory Vaccination Limit Personal Freedoms" by Australasian Medical Journal explains that herd immunity must be used to protect those too young or too sick to get vaccines. Anti-vax seems to show up in community clusters, which only adds to the threat by causing epidemics and threatening their surrounding communities. For herd immunity to be effective, it must be above 95%. States allowing religious and philosophical exemptions from vaccines threaten the herd immunity and those who cannot vaccinate. Washington Post in 2019 reported that in March of 2019, New York had the largest outbreak of measles seen in decades, with 180 confirmed cases. 150 of those was in Rockland County. To combat this, Rockland County declared a state of emergency and banned unvaccinated children from public places. Parents and guardians found in violation were fined $500 or up to 6 months in jail. Of the confirmed cases, 82% had never received a single dose of the 2 needed for the MMR vaccine. 46% of the cases were seen in children between the ages of 4 and 18. 39% were in children 3 and younger. This comes as a wave of measles outbreaks hit communities in New York, Texas, Illinois, Washington, and California. The measles are highly contagious, and a single case can lead to an epidemic. A similarly contagious infection, chickenpox, is also on the rise. As once more, Susan Scuddy of CNN reports that an outbreak of chickenpox in the private Asheville school has vaccine exemptions to blame. North Carolina does require proof of vaccination for school. However, they allow religious exemptions. The Asheville Waldorf kindergarten class had the highest number of religious exemptions in the state. Children without vaccines were required to stay home 21 days until the threat of the chickenpox subsided. However, if they got the vaccine, they could return to school. The vaccine is 90% effective. The New England Journal of Medicine article entitled "Vaccine Refusal, Mandatory Immunization, and the Risks of Vaccine-Preventable Diseases" concluded that in all 50 states, proof of vaccine was needed for school enrollment. Medical exemption was legal in all states. However, in 48 states, religious exemptions are also allowed, and in 21 states, it's allowed exemptions due to personal beliefs. Because the memory of many infectious diseases has faded from the public, the risk-benefit has shifted in favor of the perceived risks of vaccination. The main reason for vaccine refusal in the United States is concern for risks. An article from Public Health Reviews in 2012 found that in California, the personal belief exemption rate for kindergarten enrollment increased 67% from 2000 to 2010. 15 states found that the MMR vaccine coverage was lower than 90%. According to the study in 2018 by Australasian Medical Journal, anti-vax sentiment is a growing issue all around the world because of the rise of social media and the spreading of false information. The most notable and quotable being the 1998 Wigsfield article stating that the MMR vaccine was linked to autism. These claims were retracted in 2010 due to the lack of evidence as well as the research used during the study proving to be falsified. The author has since had his medical license revoked and is banned from the medical field. Many anti-vaxxers continue with the claim and add that vaccines in some way overload the immune system and cause harm. This claim has been proven false. CNN in 2018 found that most major religious groups believe MMR should be required for kids, though white evangelical Protestants and those with no religious affiliations showed support for the anti-vax movement. Washington Post in 2019 found that measles was declared eliminated from the U.S. in 2000 due to the vaccine. From 2000 to 2018, there were only 140 reported cases a year and only 3 deaths in total. With the continued use of vaccines and further medical development, the hope is to live in a disease-free world. In 1 month of 2019, there were more cases of measles than the entire year of 2018. If states continue to allow religious and personal belief exemptions, then outbreaks will continue to occur, putting those unable to vaccinate at risk. With the comeback of a previously eradicated disease, it shows that vaccination is still key, and that many other diseases run the risk of coming back if we continue not to vaccinate. Boone versus Bozeman in Arkansas states, the constitutional protection to freely exercise religion does not excuse an individual from compulsory immunizations. In this instance, the right to free exercise of religion and parental rights are subordinated to the society's interest in protecting against the spread of disease. This sums up my feelings as well. I feel vaccines should be mandatory, with exemptions only made for medical reasons. The safety of many should come above the religious or personal beliefs of one.